Today's topic is of great importance, as diabetes has become the fourth leading cause of death globally, a fact I've emphasized in previous conferences. The prevalence of diabetes is increasing annually in nearly all countries, making it clear that none of us, nor our children, are immune to this formidable disease. Its severity lies in the numerous complications resulting from elevated blood sugar levels, which damage cell receptors responsible for glucose absorption, affecting the overall health of the body. It's been widely acknowledged that diabetes wreaks havoc on the entire body, primarily due to vascular damage that impedes the delivery of essential nutrients and oxygen to cells and tissues. This leads to the common saying among sufferers that diabetes eats away at the body. Understanding the role of the pancreas, particularly the pancreatic islets of Langerhans where insulin is produced, is crucial. Beta cells within these islets synthesize insulin, while A cells produce glucagon, the hormone that opposes insulin's action. When these cells function harmoniously, maintaining a balance between insulin and glucagon, diseases can be prevented. The pancreas's anatomy, with its head positioned closer to the front wall and the tail adjacent to the back wall, influences symptoms like girdling pain and pancreatitis, although pancreatitis itself is distinct from diabetes. This vital organ, characterized by its significant length, houses various types of cells, each producing different hormones. Understanding the intricate workings of these cells is essential, particularly in the context of tumor processes where hormone production may be altered, highlighting the complexity of pancreatic function and its role in maintaining metabolic balance. When discussing diabetes, the primary issue lies in the insensitivity of pancreatic cells to insulin, resulting in inadequate sugar absorption and hormone regulation within our cells. This insensitivity leads to reduced insulin secretion, altering blood vessel function and paving the way for complications such as diabetic angiopathy and neuropathy, which often manifest as initial symptoms prompting patients to seek medical attention. Diabetes is broadly classified into two types: insulin-dependent, previously known as juvenile or type 1 diabetes, and non-insulin dependent. Insulin-dependent diabetes typically affects around 15–20% of diabetics, with varying prevalence across different regions. While it can occur at a young age, with cases even reported in small children, the average onset typically falls between the ages of 10 and 30. This type of diabetes typically emerges during these pivotal years, often characterized by a sudden onset even in individuals without a predisposition to diabetes, where heredity plays a significant role. This sudden onset is marked by symptoms such as weight loss, itching, and increased thirst, accompanied by dry mouth and mucous membranes. Insulin-dependent diabetes progresses rapidly, leading to dramatic weight loss within 2 to 3 weeks of onset. Its trajectory is easily traceable, requiring immediate insulin administration through injections to mitigate the risk of ketoacidosis, a potentially life-threatening complication common in type 1 diabetes. Ketoacidosis can rapidly progress to a coma, posing significant challenges in treatment. Failure to adhere to medical recommendations may result in recurrent episodes of ketoacidosis, affecting both the central and peripheral nervous systems. Complications progress rapidly in type 1 diabetes and can result in severe disability or even death. Maintaining normal blood glucose levels is particularly challenging in this type, with a closer association with histocompatibility antigens compared to type 2 diabetes mellitus. The onset of type 1 diabetes often occurs suddenly, even in individuals with no family history of the disease, often triggered by viral infections leading to autoimmunization and the production of antibodies against pancreatic beta cells. This autoimmune response makes it difficult to control blood glucose levels, especially in the early stages. On the other hand, type 2 diabetes, also known as adult-onset or insulin-independent diabetes, accounts for approximately 80% of all diabetes cases and typically develops after the age of 40. Unlike type 1 diabetes, the progression of type 2 diabetes is gradual, with many individuals unaware of their condition until routine medical examinations reveal elevated blood sugar levels. Surprisingly, many individuals with type 2 diabetes may not seek medical attention until they experience symptoms such as unexplained weight gain, as this type is often associated with obesity. Family history plays a significant role in predisposing individuals to type 2 diabetes. Insulin therapy in type 2 diabetes is usually prescribed to manage symptoms rather than as a lifelong requirement, in contrast to type 1 diabetes. In type 2 diabetes, the primary challenge lies in the body's ability to utilize its own insulin effectively, leading to insulin resistance rather than a deficiency in insulin production. Although an adequate amount of insulin is synthesized, the absence of functional receptors prevents its uptake by cells for necessary metabolic processes. As a result, individuals with type 2 diabetes often experience classic symptoms such as frequent urination, increased thirst, excessive hunger, and paradoxical weight loss despite elevated blood sugar levels. The progression of symptoms in type 2 diabetes can be subtle, initially manifesting as gradual weight gain before transitioning to rapid and abrupt weight loss. This sudden change often prompts individuals to seek medical attention, fearing serious conditions like cancer, which are typically associated with weight loss. However, timely intervention, including dietary modifications and, if necessary, insulin therapy, can effectively manage blood sugar levels and prevent further complications. Adherence to a healthy diet and lifestyle can significantly impact the course of type 2 diabetes, potentially allowing individuals to live long and healthy lives without relying on insulin therapy. Understanding the underlying mechanisms driving elevated blood sugar levels is crucial for patients to make informed decisions about their health and effectively manage their condition. It's essential to recognize that both type 1 and type 2 diabetes share common symptoms, emphasizing the importance of accurate diagnosis by healthcare professionals. While type 1 diabetes often presents with rapid onset and severe symptoms, type 2 diabetes may progress more gradually, leading individuals to delay seeking medical attention until symptoms become severe. Additionally, there are various secondary conditions that can contribute to or result in secondary diabetes, particularly type 2 diabetes. Identifying and addressing these underlying conditions is vital for effective management and treatment of diabetes and its associated complications. Endocrine disorders such as Cushing's syndrome, acromegaly, and pheochromocytomas can disrupt the endocrine system independently of pancreatic function. However, when it comes to diabetes mellitus, the pancreas is often the focal point due to its dual role in both endocrine and exocrine functions. Conditions like pancreatic hemochromatosis and chronic pancreatitis can directly lead to diabetes mellitus, along with various other factors, notably certain medications prescribed for unrelated conditions. Notably, drugs like high-dose estrogens, corticosteroids, and thiazide diuretics can trigger secondary diabetes mellitus. Monitoring is crucial, especially for individuals taking these medications long-term, as prolonged exposure increases the likelihood of developing diabetes mellitus. Common symptoms such as polyuria, thirst, and weight loss are typical in insulin-dependent type 1 diabetes mellitus, with fatigue often emerging as a prominent early sign. Fatigue, frequently attributed to simple tiredness, can signal an underlying metabolic imbalance, manifesting as decreased energy levels and difficulty in performing routine tasks. Similarly, recurrent infections, particularly skin and genital infections, should prompt individuals to seek medical attention and undergo comprehensive evaluation, including blood tests and glucose tolerance tests, to detect insulin resistance. Beyond the hallmark symptoms, additional signs may surface, including persistent itching of the skin and mucous membranes, often more pronounced at night. Nocturnal enuresis, or bedwetting, especially in older children, can also serve as an early indicator of diabetes, underscoring the importance of parental vigilance and prompt medical consultation. Recognizing these subtle cues and seeking timely medical intervention can mitigate the progression of diabetes mellitus and its associated complications. Therefore, it is essential for both individuals and healthcare providers to remain vigilant and proactive in identifying and addressing potential signs of diabetes mellitus, ensuring optimal management and improved long-term outcomes. Visual impairment can serve as an early indicator of diabetic retinopathy, highlighting vascular changes within the eye that can lead to organ damage. Often, patients with diabetes only seek medical attention after experiencing complications, such as thyroid eye disease, which may have gone undiagnosed by other healthcare providers for an extended period. However, with diligent management, even individuals with insulin-dependent diabetes type 1 can lead fulfilling lives with minimal risk of developing secondary complications. By closely monitoring blood glucose levels, adjusting insulin doses as needed, and undergoing regular medical examinations, patients can mitigate the progression of diabetes-related complications, ultimately reducing the risk of disability and premature death. It's important to recognize that complications of diabetes can manifest in various ways, often serving as the first symptoms that prompt individuals to seek medical help. These may include candidiasis in the genital area, neuropathic symptoms like paresthesias, and sexual dysfunction, particularly in men. Delayed diagnosis and treatment can exacerbate these complications, leading to further deterioration of health and quality of life. Some individuals may initially dismiss symptoms such as increased thirst and dry mouth, attributing them to other factors like talking frequently or a sedentary lifestyle. However, these seemingly innocuous symptoms may signify the early stages of vascular damage, which can eventually affect vision, musculoskeletal function, and cardiovascular health. By raising awareness of the diverse manifestations of diabetes and encouraging proactive healthcare-seeking behaviors, we can empower individuals to take charge of their health and prevent the development of debilitating complications associated with the disease. Early detection and intervention are key to minimizing the impact of diabetes on overall well-being and longevity. Some individuals may notice a change in sensation in their lower extremities, shifting from a sensation of burning to feeling cold. For example, a person who previously experienced burning sensations in their feet may now find themselves needing to wear woolen socks to bed due to the coldness in their legs. This change in sensation is indicative of peripheral angiopathy and warrants careful attention and investigation to identify the underlying causes. Diagnosis of such angiopathies relies on medical evaluation and assessment of diabetes-related criteria, including fasting plasma glucose and postprandial glucose levels. In medical settings, diagnosis often involves measuring glucose levels in peripheral blood, both on an empty stomach and after ingesting a sugar solution to assess postprandial glucose levels. Elevated glucose levels, particularly if they exceed certain thresholds 7.8 millimoles per liter on an empty stomach and 11.1 millimoles per liter 2 hours after ingesting the sugar solution, can lead to a diagnosis of diabetes. Regular monitoring and diagnostic testing are essential to accurately diagnose diabetes and initiate timely treatment interventions, whether through dietary adjustments, insulin therapy, or oral medications. It's important to recognize that while diabetes may seem daunting, early intervention and appropriate management strategies can effectively control the condition and mitigate its complications. Treatment approaches may vary, with dietary modifications often being the first line of defense for individuals with type 2 diabetes, while insulin therapy may be necessary for those with type 1 diabetes. Understanding the potential consequences of uncontrolled diabetes underscores the importance of proactive management and adherence to medical recommendations. The complications of diabetes present a significant challenge, affecting various parts of the body from head to toe. Diabetic foot complications encompass both infectious and vascular issues, with heart attacks often occurring asymptomatically in diabetic individuals. Similarly, tumor processes associated with diabetes can progress silently, making early detection challenging. Infectious complications pose a significant threat to diabetic patients, affecting the skin, mucous membranes, and urinary tract. Candidiasis, staphylococcal infections, and folliculitis are common, with more severe complications like pyelonephritis and perinephritis also possible. Over time, nephropathy can lead to kidney damage, contributing to mortality rates among diabetic individuals, particularly those on insulin therapy. Neuropathy is a prevalent complication, often leading to limb amputations due to lower extremity vessel damage and the formation of diabetic foot ulcers. Preventative measures include regular monitoring of blood glucose levels, cessation of smoking to prevent vessel spasms, and daily foot inspections to detect any signs of skin damage. Proper foot care involves washing with lukewarm water, thorough drying, and meticulous attention to nail care to avoid trophic ulcers and gangrene. Inattention to nail care can have severe consequences, as illustrated by cases of trophic disorders and amputations resulting from self-inflicted nail injuries. Proper nail care involves maintaining straight edges and avoiding excessive trimming to prevent tissue damage and subsequent necrosis. Additionally, wearing clean, breathable socks made of wool or cotton is essential for foot health, as synthetic materials can exacerbate moisture retention and increase the risk of infection. It's better to wrap your feet in cloth than to wear synthetic materials, especially if you have diabetes. Daily walking and foot exercises not only prevent diabetic foot complications but also enhance blood circulation throughout the body. By stimulating collateral circulation in areas with narrowed arterial vessels, you can delay the onset of complications associated with poor circulation. Atherosclerosis of the lower limb vessels can occur even in individuals without diabetes, as illustrated by the case of a young man from Mezhdyurchinsk. Improper foot care and nail trimming can lead to gangrenous changes similar to diabetic foot conditions, emphasizing the importance of proper foot hygiene. In individuals with diabetes, such as an elderly grandmother with insulin dependence and hypertension, the risk of complications is heightened. Trophic ulcers may develop due to narrowed arterial vessels supplying the skin, bones, and muscles of the foot. Necrotic tissue damage, exacerbated by infections like staphylococcal and candida, can lead to extensive tissue decomposition and severe intoxication. Vascular surgeons may recommend amputation or balloon angioplasty to improve blood flow temporarily. However, these interventions carry risks of thrombosis formation, which could worsen the condition and increase the risk of heart attacks and strokes. Early intervention and meticulous foot care are crucial for preventing diabetic foot complications and preserving overall health. The temporary effect was achieved when my mother underwent vessel clearance using balloons inserted through catheters. Despite preserving her foot for 2 years, she eventually required amputation of the second toe due to necrosis. However, I advocated for another foot resection to remove the necrotic tissue, which resulted in improved outcomes. Although Actividan was not available at the time, patients who received it later experienced significant recovery. One patient, an elderly grandmother, was initially discharged home to die after developing purulent processes and extensive necrosis. Despite the denial of amputation due to high sugar levels and intoxication, her daughter intervened and initiated treatment with Actividan. Within 6 months, her condition improved, and granulation tissue began to form. With continued care, she lived for another 4 years, demonstrating the effectiveness of proper wound management and determination to fight the disease. Similarly, another patient faced the prospect of limb amputation due to inflammatory processes. However, after 6 months of treatment, inflammatory processes subsided, vascular patency was restored, and necrotic tissue was removed, allowing for tissue regeneration. These cases illustrate the importance of timely intervention and persistence in treating diabetic complications. Despite the challenges, patients can experience significant improvement and prolong their quality of life with proper care and determination. Here, the process of wound healing is ongoing, indicating tissue decomposition despite the removal of necrotic tissue. While 2 fingers have fully recovered, the third is gradually improving and the individual, still in their early 60s, continues to work. Despite initial skepticism from medical professionals due to her age, the patient's daughter persisted in providing care, leading to remarkable results. The patient lived for 8 years after beginning treatment with Actividan, maintaining her independence and bringing joy to her loved ones. Similarly, another patient experienced significant improvement after 6 months of treatment. Despite the complexity of their condition, including necrotic tissue and damaged vessels, the body demonstrated remarkable healing abilities. These cases highlight the importance of perseverance and the potential of Actividan in promoting healing, even in the face of challenging complications like diabetic necrosis. While medical interventions such as amputation may be necessary, complete healing is not always guaranteed, underscoring the need for comprehensive and ongoing care. Ensuring timely treatment is crucial for patients with diabetes due to the cellular damage and impaired insulin receptors they experience. Medications prescribed for diabetes management, such as intravenous and oral options, often require high doses, such as 1,200 mg per day. However, obtaining such quantities from pharmacies can be challenging, as they typically stock limited amounts. As an alternative, fucoidins have shown promise in thinning blood and restoring vessel permeability in diabetic patients. Numerous studies have investigated the effects of fucoidins on diabetic patients, focusing on enhancing regenerative abilities and improving receptor function within cells. Actividan, a product containing fucoidins, works at the cellular level to promote the formation of normal insulin receptors, facilitating glucose absorption into cells. This cellular-level intervention aims to address the root cause of impaired glucose metabolism in diabetes. Research has also indicated that prolonged use of Actividan can yield beneficial outcomes for diabetic patients. By promoting cellular regeneration and restoring receptor function, Actividan offers potential for improving diabetes management and mitigating its complications. Over the course of several years, I've been using Actividan, a marine algae-based supplement, which I diligently rinse to remove any deposits that form on the walls of the bottle. These deposits are akin to the substances found in Actividan itself, known for their protective properties against seawater damage and facilitating rapid regeneration. For diabetic patients, it's advisable to consume Actividan on an empty stomach and in diluted form, as this creates a beneficial effect that envelopes cells, preventing excessive glucose absorption into the bloodstream after meals. Studies have demonstrated that diabetic individuals who regularly take Actividan experience a significant decrease in glucose absorption compared to those who do not. This results in a slower and smoother increase in blood sugar levels, benefiting both type 1 and type 2 diabetics. Furthermore, Actividan has shown promise in promoting apoptosis, the destruction of antibodies targeting pancreatic beta cells during autoimmune reactions. In younger patients, Actividan may improve stem cell functionality, potentially leading to the formation of new beta cells. While a complete cure for type 1 diabetes has not yet been achieved, the effects of Actividan, particularly in children, can lead to reduced insulin requirements. For type 2 diabetes, strict adherence to a healthy diet can often eliminate the need for sugar-lowering medications or insulin. A remarkable example is Claudia Petrovna, who, despite surviving a concentration camp in her youth, managed her type 2 diabetes well into her 90s without the need for insulin. Her story underscores the importance of dietary management in diabetes control and the potential benefits of natural supplements like Actividan in improving glucose regulation and reducing reliance on medications. Claudia Petrovna's remarkable story serves as a testament to the power of self-discipline and dietary control in achieving longevity. Despite enduring the hardships of a concentration camp, she lived to nearly 100 years old without relying heavily on sugar-lowering medications. Even when faced with other health issues, such as elevated blood sugar levels due to stress, she managed to stabilize her condition through diet and resilience, demonstrating the importance of proactive self-care. For many individuals, particularly those with diabetes, maintaining stable blood sugar levels is essential for overall health and well-being. Actividan, with its enveloping effect, can help regulate blood sugar levels by slowing down the absorption of glucose, offering a preventive measure against the development of diabetes-related complications. Additionally, by bolstering the immune system and preventing the onset of infectious diseases, Actividan can further support individuals in managing their diabetes and maintaining a healthy lifestyle. It's important to recognize that diabetes is not solely a result of genetic predisposition. Environmental factors such as viral infections can also play a significant role. By taking proactive steps to support immune health and manage blood sugar levels, individuals can mitigate the risk of developing diabetes and its associated complications. This proactive approach to health maintenance, combined with lifestyle modifications and, when necessary, medication management, can empower individuals to live longer, healthier lives despite the challenges posed by diabetes. Maintaining a healthy lifestyle is crucial for preventing the onset and complications of diabetes. By adhering to a balanced diet, managing insulin levels, and incorporating Actividan into their routine, individuals can effectively safeguard their health and prolong their quality of life. Understanding the risks associated with diabetes and taking proactive measures to mitigate them empowers individuals to take control of their health and well-being. Remember, your health is in your hands. Prioritize movement, fresh air, and proper nutrition to live a fulfilling and healthy life. With the right approach, including the use of Actividan, you can navigate diabetes with confidence and vitality. Wishing you good health until we meet again next Thursday.